Well, now we're going to look at diagnostic imaging and how diagnostic imaging takes conditions that exist in our anatomy and physiology and it tells healthcare providers more about what's going on in those body systems. To begin this discussion, we've got to divide out the two major categories of diagnostic imaging, and that is radiological and non-radiological testing. As the name implies, radiological tests are imaging studies that use radiation to produce their images. Those are things like your simple X-ray, your CAT scan, or a fluoroscope. On the opposite end, non-radiological methods, you have things like ultrasound and MRI. MRI uses magnetic imaging, magnetic resonance for its imaging. Ultrasound uses sound waves. So all diagnostic imaging tests can either be classified as radiological in nature or non-radiological in nature. Each one has a specific benefit or benefits, and then each one has some reasons that it's not an ideal method for everything. So, as a general rule, what you'll find is the less expensive a test and the less significant a test is, the more likely it is to be ordered, and the more likely it is to simply help a provider narrow down a number of possible conditions into one thing. So what I mean by that, if that sounded a little bit nebulous, I understand. What I mean by that is to say that sometimes a person might just jump right into having a CAT scan or a CT scan done, but sometimes not. Sometimes they would do there'd be a simple X-ray first. We'd find an abnormality or something, like that, and then we'd say, okay, well, let's go do the CT now. It often happens that way with MRIs, where maybe first we're looking for fractures. When fractures aren't there, then we turn to MRI because it shows soft tissue injuries and things we might not otherwise be able to see. So the overall goal when you're doing diagnostic imaging is to find the least invasive, least expensive test that will still give your provider or your physician all of the data they need to make a solid diagnosis of the patient. As far as superiority goes and advantages and disadvantages, we'll look at those here just briefly and then we'll move on. When it comes to diagnostic imaging for things that happen in terms of like skeletal injuries, so broken bones, strains, sprains, that kind of thing, the gold standard for soft tissue is the MRI. The gold standard for bones and fractures actually is still a simple X-ray in most cases. So if we were looking at a knee, for instance, and we were concerned about a knee, it would be likely that we would do get ordered to do a very simple basic X-ray to look at the patella and see what's going on there. But if we're worried about a tear in the ACL or the MCL or something like that, a lot of times that can be better visualized on MRI. So MRIs are more expensive, but they're also more definitive. In terms of a CT scan or a CAT scan, the key word to know for testing purposes there is slice. So an X-ray, a simple X-ray, is just this one snapshot at a point in time. This is what our lungs look like right now, or this is what the arm looks like right now. In the CT scan, what you're getting is a series of simple X-rays in a sort of cross-sectional way, and then all of those can be put together to look at the whole picture. So a CT of the head is one of the most common ones to run, particularly if there's worries about things like concussions. And all that is basically it's just a series of X-rays taking place in a slicing format so that you can look at each individual slice and see if you see some kind of pattern develop there. Ultrasound is something that everybody's probably familiar with. It's incredibly common in pregnancy to look at pregnancy that way. It's used quite a bit for cardiac testing, a cardiac or echocardiogram if we're worried about valvular function and that sort of thing. It can be used for a number of other things as well. So ultrasound is a very safe method, doesn't expose anybody to radiation, doesn't require sedation, pretty easy and straightforward. But again, diagnostic ability is limited. Ultrasound doesn't answer a lot of questions. It actually only answers a few. And then the last thing that you are familiar with, or at least need to be briefly familiar with, is the fluoroscope. And the key word for remembering a fluoroscope is it's a real-time X-ray image. So basically what you're talking about is a patient who's on a table, but instead of getting snapshot X-rays like that, they're essentially getting a continuous scan. So the physician, who's called an interventional radiologist, is doing the procedure. That's usually something, it could be like placing a central line or a port. It could be removing a lymph node, could be reducing a broken bone, whatever the case may be. The interventional radiologist is in control of the fluoroscope. They kind of sit behind a glass shield and they can operate it with their pedals as far as the parameters of the machine. And the idea being to do a little bit of work and then look at the fluoroscope and then do a little bit more work and then look at the fluoroscope until we've accomplished everything that they want to get done and they've been able to safely take care of what's in front of them. So for the quick recap for test purposes, classifications. So two big groups, radiological and non-radiological. You can remember the non-radiological because the parameter given in the name clearly indicates it is not radiological in nature. Ultrasound has the word sound, MRI has the word magnetic resonance. So if you feel like you're struggling to remember which side of the fence these tests go on, just remember that if you don't hear a radiological word and you hear one, a different one like sound or magnetic, it's a good bet that you go on the non-radiological side. On the radiological side, you have the simple X-ray, the CT scan, or CAT scan as it's sometimes called, and you have the fluoroscope, which is the real-time image. There are others, but those are the key elements that you need to know moving forward as far as that goes.